your nurse today. I need to do a change of the dressing on your leg. How's it feeling pain-wise?
About a scale of 1 to 10, 4.
About a 4. Alright. Okay, well I'll give you some Nurofen, which I think is on your drug chart, and then at that point I'll give you half an hour and come back and do the dressing, so that'll be about 9:30. Does that suit you?
Yep.
Okay.
Okay.
How are you feeling now? How's your pain now?
Yeah, much better.
What is it about out of a scale of 10?
A 1.
1? Fantastic. What I'm going to do here now is actually take the sticky bit off here. I'm going to have a look at the wound before I get the equipment to do another dressing on it. Is that okay?
Yeah.
Might pull a little bit,
Okay.
but we'll be as gentle as we possibly can. Gee, it sticks well, doesn't it?
Yeah.
Now, how did you do this?
I fell off my bike.
That was nasty. How long ago?
About 2 or 3 weeks ago.
Oh, goodness. It's still getting better.
Yeah.
Oh, it's a bit sore, isn't it?
Mhm.
Alright. Well, that's looking great. What I'll do is leave the dressing on it just while I go and get the equipment. If you can just stay nice and still and leave it there, covered, I'll be back shortly.
Okay.
Okay? Thank you. Scissors there, and the tape. Now, this dressing isn't sterile, so it can go underneath. It won't go on the dressing pack. Open up the dressing pack, making sure that it's in date. And then use a bit of tape to stick the bag on the side of the trolley. Opening the dressing pack, the first opening is away from you, so you're not leaning over the dressing pack later on. Pick up one set of forceps and use that to set out your dressing packs. Keep in mind that the outer 2 centimetres of the sterile field are considered to be unclean, so you can put the end of your forceps in there if you want to. You take your saline, once again having checked the expiry date, and pour from about 10 centimetres above into the tray. Using your forceps, just moisten and wring dry as many as you're going to need to clean the wound, and leave a couple for drying. Add any other dressing materials you're going to need at this point as well, making sure that you don't touch anything. All right. Chris, I'm going to start this wound dressing now. I'll pop on some gloves, which will help keep it clean.
Okay.
Open up our sterile field. I'm just going to put it down to the side, sweetie.
Okay.
Okay. Now, I'm going to pull this off and just pop it straight into the bag along with the forceps that you've used to take it off. At this point, you now have, for the moment you go near the wound with this other pair of forceps, they become dirty forceps. Right, just sit nice and still for me. Does that feel all right?
Yeah.
Alright, I don't think it'll need much more on it. And just this bit of melanin, Chris.
Okay.
Alright. Does that feel okay?
Yep.
Everything's getting stuck up here. Here we are, and we'll change that again tomorrow.
Okay.